See you later.
Hello, everyone. Welcome again to this wonderful session of the Zipinar. Let us talk it, where we zip the bliss of knowledge in just 1 hour. So, two brand new and wonderful topics to be delivered by two wonderful speakers today. Thank you so much for joining us. And we are also live via Facebook and YouTube. And for those who have been watching there, thank you so much for your effort in joining us today. So, the first topic for today will be the riskiest asset class, startup investments. So this, like, we want to know what is it and what is the role of investor relations. And to deliver this topic will be Nika Karabelska. And she mentioned that recently she have been working as a client relations manager at Funderbeam. It is a company that connects startup investments with the potential investors in Estonia, a mini Silicon Valley in Europe. Right after university, she have worked in multiple startups, innovative businesses, and simply she describes it as very exciting. So to deliver this topic with us, I present to you Nika. Please take over.
Hi there. It's so nice to be here. Thank you so much for the presentation. All right, I'm gonna just add, that Filjan, you're all correct about the exciting world of the startups, investments, and generally. But yeah, if I think about my life after the university, not only the technical skills that I have received, but I have been all surrounded by the startup ecosystem. And today I wanted to actually talk about this topic because it's so interesting and I would say complex at the same time. I'll start with something like a background about myself. I studied basically economics, politics, and philosophy in the UK. And it gave me a really good understanding, let's say, of how the whole world works. And then I joined a company that was basically, again, a startup that had like 120 people in it when I joined. And in, let's say, 4 years or something like that, they grew like 4 times fold. Yeah, so it was a very small boutique company, but then it grew. And what I'm currently doing is basically I invest in such startups. So my experience is all about small companies that grow with scale. And right now I'm basically in a company that fuels this growth. So today, what I want to talk about is basically this asset class. So I try to basically think that no one knows any of those words and just to basically break it down one by one. So if we think about risk, we obviously think about something like that brings us harm or danger, right? That is basically like has a negative connotation. But here, if we talk about investments, is basically a loss, right, of the monetary loss, all your money. So I work with such kind of cases in startups. Startups are, let's say, named and always thought of as the riskiest ones because you basically can acquire the biggest loss when you invest. So when you think about stock markets, right, you invest like, let's say, $100, $200 and you lose them, and that's fine because you just bought a couple of different shares from Apple, or 500, and etc. And you lose it and you don't think it as a big loss. But in startup investments, when you invest, especially when you invest like a big amounts, because it's quite important to invest big amounts, you will almost most certainly lose that money. So that's why it's very risky. There is a theory that 1 out of 10 startups are basically becoming successful, and you get a lot of return on your investment. But that's only 1 in 9, not like in the let's say stock exchange market, where you can more or less predict where your money is going to grow, or where you're going to lose, and that's not a big loss of your investment. So it's considered in that respect risky, because you have the biggest loss. And then if we go about what is a startup, actually, then we just think about a company that is at the very initial stages of the business. So I like to think about it as a metaphor, like a child. So when we basically, when a child is born, or even before that, the parents are thinking about an idea of borning a child. This is basically a startup idea. And when the child is born, it's very, very early stages of his growth, the first month, this is a startup. When he learns how to walk, learns how to eat, it's a very like shaky kind of state of a business, right? It's not a already developed and adult phase business where you make a lot of profit. So this is how I would describe a startup. Initial stages of businesses where you experiment, you test your idea, and you innovate, so that then you can actually create a working business that would grow and mature. So I hope I could, let's say, nail it down to this kind of simple terms. But if to go more in detail in terms of a startup life cycle, in terms of investments, more into the terms, a startup has different stages where they can raise funds. They can raise funds when it's even on the idea stage. Yeah, when you just have like some kind of idea that this product is going to be really useful for the people, and it's going to be sold, and you making a prototype. So to take an example, well, something that I do basically education, edtech industry, right? So, and in this example, we could take, like, let's say a Duolingo, like an app that, you would basically learn a language through games, making games, right? So this is an idea, but it doesn't exist. Let's imagine. So this is an idea stage. So this would be an idea stage. Then you have a pre-seed stage. A pre-seed stage is usually when again you have concepts, but you might have already created a prototype, or a first, let's say, well, or you're going towards understanding your market. What do the customers want from you? You have the first trials with them, and you research about other competitors. And usually at this stage, you might not even earn any revenue. But guess what? An interesting information: people still raise money in this stage. So not having any kind of sales or any kind of, basically tested in the market, they can already raise some money at this stage. Then you have the seed stage, which is basically where you have the MVP, minimum viable product, or a prototype, and that's usually in the terms of investment world would be already some kind of a IT solution, right, at this stage, and it could be even just a mock of a website, right, where you could have just buttons to click, but nothing really happens, and you just get an idea of what the product could be, and basically if you even click that you want to purchase it, you get an email that, all right, it's still in a development, but here is how it has to look like. So this is how companies at this stage are testing if this idea really fits the market, so if people really need this. So now what are these kind of investments, and where do they happen? On a normal life, this kind of investments happen usually in venture capital, right? So these are basically big funds, 50 million euros dollars funds, where these funds usually come from LPs or government. They are gathered and then they are invested in those startups. Venture capital invests usually in pre-seed or seed. So the ticket sizes would be from 100K to 200K per startup, or even further amounts. And this is where Funderbeam also is playing. Especially exactly in the crowdsourcing, basic crowdfunding, crowdfunding zone. So yeah, these are two players: venture capitalists, Funderbeam, like a crowdfunding platform, and also angel investors. Angel investors are the people who basically have done all it takes to build a mature business, and they have money, let's say from the even sold shares, their option shares, etc., or they have exited and then they gotten the money and they want to invest and help another startup to succeed as well. So angel investors are usually just one person who helps in a company. Right, so this is how the startup investment work. And I wanted to go a little bit further into the model or business model that I'm working with, because I'll drop it here right away. I think it's the healthiest model that you can think about, and I'll explain a little bit later what it is. So what Funderbeam does is basically, if you were, let's say, even you, Filjan, you could invest in a startup. So you can even become someone who would earn a lot, a big percentage of your return on investment, right? So like say 3 times, 4 times increase in your investment, right? Obviously we are talking about losses the same way. I need to mention that. But yeah, even you could become an investor in a startup, because if you think about venture capital, right, and a government, LPs, what is that? No, but Funderbeam and crowdfunding allows us, basically people like me, people like you, to invest in startups. And in the model that they basically are using is called syndication. So that means that a lot of investors like us are gathering in one like syndication. It means basically group of people, and invest in a startup. Funderbeam acts as a person in between, or let's say a platform in between the investors and the group of investors and the startup. I'm not going to go in detail of the legal details of how it happens, but it's basically that investors are granting the rights to Funderbeam to act on their behalf, to basically invest in the startup. Obviously, there are possibilities that the investors have the say in a company when there are corporate events and votings happening. So people decide, people have, let's say, questionnaires where they decide how the company should behave. It happens also. So this is how crowdfunding works usually. And what Funderbeam offers, what venture capital doesn't offer and some crowdfunding platforms don't offer, is the opportunity to exit your investment really easily. So when we think about startup investments, and this is important to understand, a startup as a child needs time to mature, and maybe it needs your care and support and time for a long time. Yes, so you don't invest just once, you might invest another time and another time. So there are statistics saying that it takes approximately 12 years for a startup to become let's say a unicorn, or let's say reach some kind of really profitable stages or an exit. And so the idea is that you would feed the startup again and again, and then at one point you can have that return on your investment. So what I'm trying to say with this idea is that Funderbeam, it allows you to exit from that stage at any point. So for instance, you invested in a startup, in an edtech startup, and you think that it's not going well, and things are not going well, and you have the ability to exit this investment, to sell your shares on our marketplace and exit the investment. At the same time, it allows you to sell your investment in the middle, maybe, of this stage where like the company raises funds again and again, and you get even 2 times return, on your investment. So it really works similar to the stock market, right? But there is no company actually that exists that allows you to exit a startup investment. Yeah, it's important to understand, at any stage. So in venture capital, when you invest your money, you will hold them up until the time that the company exits, and that might take 5 to 10 years. But in Funderbeam, you can even exit the next day. So this is the new and innovative, groundbreaking idea that Funderbeam is bringing on the table, for instance. And one of the latest products that we're offering for startups, because we work like mostly with startups, is that they can basically stay in private, meaning that they have their own investors, like angel investors and some of the public investors, for a long time with them in the platform, and raise again. And yeah, this is the thing that we're offering. So just to wrap up this topic about, in a way, on the startup investments. So in venture capital, as a classic venture capital, how it works is it's almost like a betting and gambling, right? So they have 50 million dollars, euros, and they basically choose from 10 to 20 startups that they want to invest. So imagine that they would spread this money to those startups. Yeah. And which means that obviously, if you understand the idea that the startup needs feeding for 12 years, you would not have enough amount of money to invest in those startups for 12 years to all of them. So that's why, one of the things maybe I understood about this industry, and why Funderbeam is the healthiest investment that could be in startups, is that venture capital kills those companies in a way, because of that gambling that they have to do, because of the system, how it is, right? Because they have this limited amount of investment that they can redistribute, and some of the businesses, they just don't have enough food, and so they die. And that's why 9 out of 10 die, in one sense. This could be one reason that this is the theory. But Funderbeam does this, that angel investors who invest into startups, because they have this working capital, and the retail investors, the public, who actually can also come in, they make this pool of money almost unlimited to invest again and again into the startups. This is the direction I hope that we're going with Funderbeam. All right, so this is what I wanted to talk about, the startup investments, but my role in Funderbeam is basically all related to clients, basically investors mostly. And one of the idea that I wanted to bring to the table about this role is that when we think about client relations, we obviously think about support, help, We think about technical queries. Yeah, think about any client relations role. I mean, in customer support, yeah, on Apple or any other company, you have all of those lines where people call. So what's wrong with my iPhone? Why it doesn't turn on, etc. But when we think about investments, we're working with people losing their money and gaining. But when you think about support, is usually when a person is down, right, and he needs some help. So when we think about a customer support, or let's say client relations in a startup investments, it's a lot maybe more stressful, because those people are losing money, and since we have this very big connotation about money in the society, that losing it's a very difficult psychological thing that people go through. We not only get technical questions in the investor relations role, but we also get a lot of those questions about how come the company didn't report on their situation, and how come did I lost my money, and what Funderbeam does about it. So when I talk about investor relations role or a client relations role, I always think that it is a very interesting one, because when I think about automations, for example, in the future, right? So I think that this role is one of the most difficult to automate, because you are dealing with people on a very difficult emotional state. Yeah. So yeah, it's very simple. Investor relations, it's basically a department, a part of Funderbeam, and generally any company is a division of a business, usually where a person has to provide, let's say, a very accurate account of company affairs, and has to manage different stakeholders. Like he has to manage, let's say, the company and all the people and all the investors, right, that invested in this company. And this is again a twofold communication. So yeah, this is what I wanted to talk and tell about the role, that when we think about customer support in investment world, then we think about a very stressful a job, where we have to be really fast to respond, we have to be very understanding, and we also have to have the knowledge on how to calm a person down when he loses his money. And I have been thinking about this a lot, about how we should do that. Because if you think about even a technical support in an Apple, etc., they are very eloquent in how they support you, and they also obviously provide the psychological support. But when you think about investor relations, you have to be, in fact, really in a way emotionless, because I think I mean, the idea that I'm trying to put to the public is that money, it's important, definitely, but when we think about investments, it's very important to be professional in what you do, and you can always research. When you think about usual customer support, you can your order didn't come, you don't have to have the knowledge about the order and the system, right? But when you think about investments, it's very important to be knowledgeable and learn. So when I am doing my customer relations with investors, I'm quite blunt and honest that here's the information that you have had to read or research. So this is what differentiates, I guess, my client relations to all the usual customer support. And the fact that I have to be actually very cold and to the face. And the last thing, to really close on a very fun note, I wanted to basically talk a little about a edtech sector, because I think it's the riskiest startup investment of all. Because if we think about the startups, it's definitely some businesses that disrupt the market, right, and have disruptive solutions. And so I think that education market is one of the most stagnant markets in the world generally, and there has the system is very rigid. That we have been educated in schools and in universities is very rigid, but at the same time, people learn in so many different ways, and our life and our essence of life is all about learning, right? In my opinion, we always learn
Right.
from our children. So it is the riskiest of all, is the most difficult to change and disrupt. And at the moment, there is an urge for me to, let's say to the people that you should be looking into this sector. And another point I wanted to say, what are the future trends in educational sector, and I'm going to be really repeating words of some wise people. Maybe to succeed, you have to do everything that people don't do everything on the opposite side. And a lot of people predict that the edtech sector, because it's tech, it's going to be online, and there's going to be a lot of solutions in the online sphere. But I want to take a stance and say that actually, I think that the revolution is going to come in the offline sector, and in that sense, it's a hardware. Right, because it's not a software. And I would urge people, if they want to invest, I would invest right now in the solutions in the offline sector, in education, because people will want to socialize, and when they socialize, they learn. And so when we provide offline spaces as well as online, definitely, I think this is going to be the future as well. One of the, for example, the recent trends, recent startups that we have on the Funder Beam, it's a Friendly Fire. It's basically a gaming cafe. I know it's almost the thing of the past, but at the same time, it's growing really quickly. It's a franchise model, and I believe that it's a very good investment at the moment. I'm not recommending it. Startup investments are including risks, but it's just my personal opinion that offline products and offline educational sector is going to be something that I would invest my time and interest effort in, and that's what I'm doing. And that's it for from my end. I'm open for any questions. I actually saw some in the chat.
Thank you so much, Niga, for that wonderful session. Like, risk itself is kind of heavy work, but setting aside, like, answering to those who have risked their money is a really tough one. So a great job doing that. And I want to know if the question of Satya has been acknowledged. And another question he has is, any other platform where we can read about current startups?
That's a good one. Well, you know, the competitors of Thunderbeam, Seeders, Crowdcube, and there are many actually which are appearing at the moment. Definitely, if you're an angel investor, AngelList is an interesting platform to look for. And definitely, if I think about startups, I would always think about the UK. So any outlets that you can find to read about startups in the UK. And yeah, I would say look for competitors of Thunderbeam. I also see another one. How does one choose the potential startups to invest? It all depends on a profession, like a level, a professional level of an investor. So if we think about angel investors, they usually invest in something that they have worked in, they know the industry. Again, something coming back of the knowledge and experience. So this is one thing. And then, but a lot of people say it's the team and people that but if you're, for example, a retail investor, a lot of retail investors, meaning that ticket size from 250 to 1,000 euros per investment, they are looking for brands they know in their region, and they invest there as well, because it's a really simple model that they can understand, and they invest there. For example, electric bikes, one of the brands here in Estonia. Yeah.
Perfect. So are there any other questions that Nika can answer? You can put it on the Q&A section, or you can do it in chat, or you can open your mic, definitely. And while we are waiting for someone who would raise their hand or ask question, like there might be potential investors watching us on our live, or could be here in a Zoom right now. How would they reach out? Like how would they get through Funderbeam?
I can drop the website on in the chat where you can have a look, and I'm gonna be the person who is probably gonna meet you there on the platform. Yeah, it's pretty easy to sign up. Just need some documents to present, because it's all secure. We also accept Singaporean and USD currencies, so it's not only euro based as well. Yeah.
If you could say something about Megas.
Well, yeah, this is so Megas Group is a startup of our own. I'm a co-founder of a edtech startup. We're actually at the moment in the seed stage, I would say, idea concept, testing the product, seeing market fit. And basically what we do is we innovate the educational experience, and we want to bring fun, we want to bring enjoyment into the educational process. We offer basically not only online classes in English, but also innovative, let's say, approaches to education and to providing knowledge. And that's mostly done by creating, exciting and engaged presentations and connecting them to your favorite movie series characters. So if you want to learn English and improve it, you can improve it with Harry Potter. You can improve it with I hope in the future, Matrix movies, etc. So yeah, basically it's at the moment it's basically an online school. A lot of two branches of online school in Azerbaijan and Estonia, but the vision is to innovate completely the learning experience, whatever it may be, because startups change their ideas every time and innovate and find, the ideas.
That's perfect. So we hope you for the best for that plans that you're having. And I guess there are no questions. Yep. So we have here.
Yeah, hi, Nika. Thank you so much for joining and sharing your wisdom. And also thank you, Lisa, for introducing another wonderful personality other than you.
You're welcome. I was really happy to watch Nika talk. She told so many new information today. It's very interesting.
Yeah, in the startup world, we definitely need a lot of brains to start working together so that we can minimize, a lot of the risks, because that's where I think our collective, wisdom plays a role. because when somebody really loses money, or when somebody is not successful in the first startup, there's a lot of demotivation, and some may not even proceed further. So the spirit of entrepreneurship is killed right there and then. So probably, we need to really have this ecosystem to really guide them and mentor them and predict the failures and successes in the best way possible. I think, we should definitely continue the dialogue. And definitely, Lisa, I think you're also going to be active in the LetUsTalkIt hosting platform. So that's
yes,
that will be nice to know. So thank you again, both of you.
Thank you for inviting.
Thank you very much for having us.
Lisa, thank you.
Thank you so
Nika.
much.
This is Shito.
Yes, we have Shito. Go ahead.
Yes. Thank you, Nika. And I was very excited to log in and listen to you also because I'm in Tallinn and I don't know if you are here or you're somewhere else, but they just told me that you're from Tallinn.
Yeah, I'm in Tallinn.
Oh, okay. So I'm in Tallinn too, and I'm getting certified and attending this Mind Valley University, which is what you're talking about, one of the unicorn startups. And I was very happy to find out that Tallinn has the highest number of entrepreneurs per capita in the world, and highest number of unicorn startups per capita in the world. So I'm excited, and maybe we can connect offline. Yeah.
I'll send the links in the LinkedIn and the company and everything. Thank you so much for listening. It's really a pleasure.
My pleasure.
Yeah, thank you so much for the wonderful talk, Nika. All right, so we can end your part, and then we can go to the next topic for today. So this is different now. So we were talking about startups and how they grow, and now we will now talk about like work disorders or cumulative trauma disorders. So these are the things that like we do not know, like we're already doing that affects our like position, our posture, and could be further fatal as we age further. So this will be delivered by a good friend of mine. He's from Philippines as well. His name is Dr. Rajiv Noel Gloria, medical doctor. And he's currently, he's a physical medicine and rehabilitation resident doctor and a university graduate, faculty of medicine and surgery graduate. So he's currently a second-year resident doctor specializing physical medicine and rehabilitation. So to give us this topic regarding work injuries or cumulative trauma disorders, here is Dr. Rajiv with us. Please take over.
So hello, good day to everyone. So today I'm tasked to talk to you about work injuries or cumulative trauma disorders. So before proceeding, I'm just going to give a quick description with regards to work injuries and cumulative trauma disorders. So for cumulative trauma disorders, these are injuries to the nervous and musculoskeletal system attributed to repetitive physical tasks, poor sustained postural biomechanics, vibrations, and or repetitive forceful exertion. So this is an umbrella term that includes multiple specific diagnoses and non-specific conditions affecting primarily the upper limbs, our shoulders, neck, and our lower back. So among the most common cumulative trauma disorders, so this includes the lumbar back pain or low back pain, the carpal tunnel syndrome, epicondylitis or elbow pain, neck pain, and Decker vein stenosynovitis. Okay, so again, to emphasize, the causes are usually ergonomics, repetition or prolonged activities, forceful exertions, poor posture, and vibrations. So usually it is caused by inflammation of the tissues, collagen deposition, and tissue contraction. So this can lead into pain or loss of motion of the specific part of the body. So prolonged muscle contraction can lead to a decrease in the local blood flow, deoxygenation, and metabolite buildup that manifests as muscle fatigue and soreness. So first, we are going to talk about neck pain. So for neck pain, so we have the so-called tension neck syndrome, which involves persistently stiff neck muscles, resulting in aching discomfort at the base of the neck, upper back, and at the base of the skull or the suboccipital region. So this is usually caused by a poor neck posture, and it's strongly associated with occupational neck pain and appears to be the most significant factor in work-related neck disorders. So the signs and symptoms of neck pain may include weakness, numbness, or tingling or burning sensation, which would radiate to the shoulders or the arms. So here we have a picture of the basic anatomy of the neck. So here we have our muscle, the nerve, and then the specific bones of the body. Okay, so here we have 7 cervical bones, which would contribute to neck pain. So any injury or impairment from the muscle, the nerve, and the bone would lead to neck pain. So usually when we have neck pain, we have radiating pain. So it starts from the base of the neck, and then it would radiate to the shoulder, up to the level of the arms, and sometimes the fingers. Okay, so the area affected would depend on which nerve is being compressed at the area of our neck. So here we have, in medicine, we call it the dermatomal map. So here, for example, if we have impingement at the area of the neck, specifically the second cervical spine, it could also present as headache, okay? And then if you have impingement of the nerve during the lower area, so for example, at the level of the C5 or C6, it would radiate to your upper arm or your thumb. And then if it goes further down to C7, it could also proceed up to the middle finger. So here we have something that's very common today due to the innovation of our gadgets. So we have the thing that we call the texting neck syndrome or the forward head syndrome. Okay, so usually due to chronic use of our mobile phones, we usually tend to develop this hunched forward position or the forward head syndrome. So usually what happens, we have a tightening of our muscles here at the anterior portion of the body. And then at the same time, there is prolonged contraction of our muscles of the back, so specifically our trapezius muscles. So due to frequently checking our phones, we usually tend to look down, which causes a stretching and at the same time contraction of the muscles of our trapezius. And then we have a tightening of our muscles here at the neck. So we have a hand hunch forward position or the anterior head syndrome. So usually patients with this, they usually present with muscle spasticity at their neck. And then at the same time, they usually feel any radiation which radiates to their arms. So usually diagnosis of neck pain would include X-ray to identify which specific bone is affected in our neck. And then usually we would request for MRI if there is if it is accompanied by weakness or sensory deficits. So in the MRI, we are able to see whether there is soft tissue damage, specifically the nerves or the muscles, if there is a tear, that could lead to neck pain. So for the treatment of neck pain, we would usually prescribe physical therapy, carry neck exercises, and postural correction exercises. And then for the management, usually it is relieved by pain relievers and then muscle relaxants to treat those tightening muscles and those with muscle spasticity. Okay, so next we are going to talk about the low back pain. So for low back pain, it is a costly burden to society and the leading cause of disability worldwide. So most people with new back pain recover quickly, but for a few, pain becomes persistent and costly. So same with neck, the signs and symptoms would also present as stiffness, muscle spasm, and tingling sensation from the back or buttocks radiating to the legs. So checking our basic anatomy, so it's also the same with our bones in the neck. So we have here our muscle, we have our nerve, and then we have our bone structures, okay? So again, for the specific pain, for the low back pain, so here we have here a dermatomal level again to represent whenever which part of the body is compressed. So it would also radiate to that part of the body. Okay, so we have here the bones of our lumbar spine. So for example, we have here the L5. So if there is a compression in our L5, this nerve would also be compressed. So for the S1 nerve root, it would also present as what we call the sciatica. So it usually presents pain from the back, which would radiate going down to the legs. Okay. So here I have here a graph which shows the relative pressure in our spine and the different positions of our body. So we have here 100% during standing. And then the position which is very at risk for injury is sitting down with your body bent forward while you're holding a weight downward. So it's the one who can usually produce the most chances of injury. So usually we also see here the deadlift. So when you're doing the deadlift, usually it also has a chance to cause low back pain if done incorrectly. So usually would recommend a certified trainer in doing deadlifts in order to prevent the specific injuries that could be caused through lifting the weights. So for the diagnosis, we usually diagnose low back pain through history and physical exam. And then from there, we would usually request some X-ray or MRI. So the same as the neck, if we are currently entertaining a bony pathology, we would request for an X-ray. And then if there is subsequent weakness or sensory deficits involved in the extremity or the leg, we would usually request for an MRI. So same with neck pain, the pharmacological management would include pain relievers, muscle relaxants, and then physical therapy. So usually during the physical therapy, we would recommend core strengthening exercises, which is basically the cornerstone for prevention of lower back pain. And then based on the specific movement of the patient, so if the patient has pain whenever he or she is moving forward or bending forward, we would usually prescribe extension exercises in order to counteract the pain. So the same if the patient has pain upon extending his or her back, we would recommend Williams flexion exercises in order to counteract the pain that is produced during the extension of the back. So here are the red flags that you should usually watch out for. So some of these would indicate immediate MRI in order to rule out emergency cases. Okay. So the most common here is history of violent trauma, such as falling down. And then there is subsequent numbness or weakness or pain, which is radiating to your lower leg. Okay. So as well as the history of cancer, drug abuse, unintentional weight loss, fever or night sweats, structural deformity, and then whether you have bowel or bladder symptoms, so you have difficulty in urinating or difficulty in relieving yourself. So usually it would also present as an emergency because it means that a part of your spine is being compressed by a structure or possibly a mass at your lower back. Okay. So we also have here a progressive motor or motor weakness or gait disturbance, meaning there is a change in the pattern that you walk. So usually when we have this change in pattern of walking, it usually shows weakness. So there's probably a compression, and then progressive, meaning it is probably an expanding mass or expanding inflammation or soft tissue injury, which could lead to further complications in the long term. Okay, so next we're going to talk about another one of the most common workplace injuries, especially for people working at the office, which is the carpal tunnel syndrome. So for the carpal tunnel syndrome, it's usually the compression of the median nerve. So there's a specific nerve affected. It is usually called gamer's wrist due to gamers, which is they're resting their wrist for prolonged periods of time due to typing or use of the mouse, okay? So there's usually numbness, pins and needles or tingling sensation, weakness, and atrophy or decrease in size of the intrinsic hand muscles. So the symptoms are usually worse at night. And then patients with carpal tunnel syndrome usually present with the flick sign. So what they usually do, they flick the wrist like this in order to relieve the signs and symptoms of the carpal tunnel syndrome. So as you can see from the picture, the median nerve comes from our neck. It goes downwards, which supplies the inner part of our arm. And then once it reaches the wrist, it usually provides a sensation and motor movements from our thumb, our index finger, our middle finger, and 1/2 of our ring finger. So we also have this specific deformity in chronic carpal tunnel syndrome. So the carpal tunnel syndrome that remains untreated would present to us with an ape-hand deformity. So this is what it would look like. Okay, so if you observe, as you can see, the left hand here is the one that is normal, And then the right hand here is the one that is affected by carpal tunnel syndrome. So again, to review, our median nerve supplies the thumb, our index finger, and then our middle finger. So our median nerve would course in this pattern, supplying those areas. So chronic compression of our median nerve would result to a decrease in the size as well as weakness in the muscles of our hand. So usually you can see this as compared to the left hand of the patient. You can see comparing both hands, there is a bulge in our left hand while there is a decrease in size of our right hand. So it's called ape hand deformity because chronic carpal tunnel syndrome resembles the hand of the ape. Okay, so that is due to the flattening of our muscles here at the base of the thumb. Okay, so you can check if whether you have carpal tunnel syndrome on yourself. So you can perform this test alone or with a partner. So usually we do the TINUS test first. So what you're going to do is you're going to tap the wrist area at the center wherein the median nerve passes through. So when you tap it, and then you reproduce the symptoms such as the pain, tingling, or burning sensation, and then it would radiate to your thumb, index finger, and middle finger. It would be a positive test for TINUS test. So it could indicate that you probably have a median nerve compression or carpal tunnel syndrome. And then another test that you could do alone is the prayer or the phalanx test, wherein you're just going to hold your hand in a prayer position or in a reverse prayer position. And then you're going to hold it for about 60 seconds. And then if there is a reproduction of the pain as well as the tingling sensation again, it would indicate a positive for the prayer or phalanx test and positive for carpal tunnel syndrome. So usually for diagnosis at the clinics, we would usually do ultrasound of the wrist. So for the median nerve, you can see here, it's the one that is marked number 4. And then you can also see the surrounding structures such as the bones and the muscles surrounding it in order to identify the specific cause of inflammation. If there is any form of deformities or malalignment, it could be seen at the ultrasound. And then we also have here the electromyography or the nerve conduction studies, wherein we are going to test how fast the median nerve or the nerve affected in carpal tunnel syndrome would be able to detect stimulation. So for the management of carpal tunnel syndrome, usually we would prescribe relative rest for around 2 to 3 weeks. However, due to, of course, you have to work. So we would usually provide the patient with a nighttime splint, or also known as the cock-up splint. So this is what would it look like. And then it would be accompanied by anti-inflammatory medications, tendon or nerve gliding exercises. And for chronic cases, we would recommend local corticosteroid injections in order to decrease the inflammation of the nerve. So next we have the decurvane stenosynovitis. So decurvane stenosynovitis. So when we talk about the median nerve, it's usually called the gamer's wrist. The decurvane stenosynovitis is called the gamer's thumb. So this is usually precipitated by activities, repetitive activities such as buffing, ringing, grinding, polishing, sanding, sawing, cutting, and screwdriver use. So basically any activities that would involve your thumb and repetitive motion in it. Okay, so usually the area affected is pain and swelling at the base of the thumb. So in order to know if you have decurvane stenosynovitis, we would usually do the Finkelstein test. So all you have to do is you place your thumb in the middle of your hand and then form a fist. So you can ask somebody to tilt your hand down, or you can also tilt it yourself. And then once you have pain at the area of here, it would usually indicate that you have the decurvane stenosynovitis. So for the management, same as the carpal tunnel syndrome, we would usually recommend ice for 15 minutes every 6 hours, or the anti-inflammatory medications, since the specific part of our body is affected here in the gamer's thumb is more of muscular in origin as compared to the carpal tunnel syndrome, which is nerve in origin. Okay. So we have the orthotic devices also. So if we're giving a wrist cock-up splint for the carpal tunnel syndrome, we usually give thumb spica for decurvane stenosynovitis. So this would also promote healing because it would prevent our thumb for unnecessary range of motion that would further complicate the injury. So again, same as carpal tunnel syndrome, we would usually recommend steroid injection if the patient usually complains of pain even after 6 weeks. So last that we're going to talk about here is epicondylitis, which is also known as the elbow pain. So epicondylitis, so we have lateral epicondylitis, which is termed tennis elbow, or medial epicondylitis, which is also termed golfer's elbow. So it would also differentiate due to the area of pain. So when you say lateral epicondylitis or tennis elbow, it is usually pain at the outer portion of our arm, and then or our elbow. And then when we talk about medial epicondylitis or golfer's elbow, it is usually pain located at the inner portion of our arm. Okay, so this usually present or pain and weakness on specific movements of our arm or elbow. So for the special test, again, you can check this for yourself. So for the Cousins test, all you have to do is you place your arm like this in a 90-degree position, and then you ask the person to extend his or her wrist while applying a pressure or force to counteract it. So usually when you ask the patient to extend and then you resist it, and then the patient feels a pain at the outer portion of the hand, it is positive for lateral epicondylitis. And then for the medial epicondylitis, we usually do the reverse Cousins test. So instead of extending your wrist like this, we usually flex it going towards the body. So when you flex here, you apply a pressure or a force. Usually you are going to feel the pain here at the inner portion of the arm. So usually when we do the diagnosis at the clinic, we usually perform ultrasound. So as you can see here, here is the bone, the medial epicondyle or the elbow bone. And then we have here the fibers of the muscle, which attaches to the elbow. Okay, so you usually see here at the part wherein there are arrow pointed. So this would usually indicate a tear at the muscles of our inner elbow. So when you look at the MRI, we usually see here, for the MRI, this one is the lateral epicondylitis or pain at the outer portion of the elbow. So usually you see here, there is also tearing of the muscle, which is attached to the lateral epicondyle, which would indicate pain at the outer area of our elbow. So for the management, again, we cannot overemphasize the relative rest as well as activity restriction, icing, anti-inflammatory medication. So what's interesting with elbow pain, usually topical anti-inflammations or pain relievers that you usually apply through the skin, they are effective in managing epicondylitis for both the medial and the lateral or the inner and outer elbow pain. So we would also recommend strengthening of the muscles in the forearms and the wrist. And then we also have a counter force strap. So what this strap does is it decompresses the affected area. So be it your inner elbow or your outer elbow, it would relieve the compression that is provided by the tendon upon movement. So it prevents injury. At the same time, it provides comfort for the patient. So limited evidence to support deep tissue massage as a treatment options because there are conflicting studies whenever you massage the inner portion of your elbow as well as the outer portion. Okay, so how do we prevent all of these injuries? So in prevention of these injuries, we would usually like to correct the position or the posture. So we have to avoid extreme movements of the elbow, the wrist, as well as the forearm. So during repetitive work, they should be the shoulders or the upper extremities should be relaxed, and then the elbow should not be flexed to more than 70 or 90 degrees. So we should also avoid prolonged maintenance of the elbow in the overhead position during repetitive, as this would cause shoulder pain as well as neck pain. So we need to avoid activities with sustained grip or pinch, repetitive side-to-side movements of the wrist, and sitting in the same position for extended periods of time, as this would cause neck pain and low back pain. So it is very important to take breaks and to stretch and walk around for around every 25 to 30 minutes. So next, for the seated or computer workstation, so the top of the computer monitor should be in line with the worker's eyes, allowing for a natural downward gaze angle of 15 degrees towards the middle of the screen. And then the distance of the monitor should be around 12 to 18 inches. This is due to if the monitor is too close, the worker will experience eye strain. When it is too far away, the worker is forced to slouch forward, increasing the stress throughout the entire spine, which would lead to, again, neck pain and back pain. So while seated, the worker's feet should rest on the floor with the knee flexion maintained at 90 to 105 degrees. So this would prevent another reason that would cause for prolonged work injuries, which is prolonged contraction of our muscles during sitting. So if the feet are not resting on the ground, a footrest should be used, and then the ideal seat depth should allow 1 to 4 inches between the area behind the knee and the front of the edge seat. So it is important for us that we have a space in between our legs, specifically behind the knees, so that we can prevent the compression of the nerves that travels at our posterior portion of the leg. So the backrest should support the lumbar curve or our lower back while maintaining the contact of our upper back with the chair. So it is important also to adjust the keyboard and mouse height so that the elbows can be flexed at a 90-degree angle and the forearms parallel to the ground. So this would promote relaxation of our extremities to prevent the injury. So here is how it would look like. So here we have a very no-no. So this is a bad example of poor ergonomics during the workstation. So as you can see, the patient here, his back is not in contact with the chair. We have no lumbar support. Our patient is showing us signs and symptoms of chronic forward head posture. So most likely this patient will present with neck and shoulder pain. Okay, so here is the idea, the correct sitting position. So the monitor is distance around 18 inches. So the upper back is in contact as well as the lower back. We have here a space of 1 to 4 inches. So we don't have any structures that is being compressed behind the knee. Okay, so I have here a pamphlet from our pharmaceutical company, which will show us how to prevent neck pain on different positions. So we have to avoid frequent neck extension. So when drinking, we would usually recommend using a straw. And then we avoid bending the neck backwards during shaving. So work which requires the neck to be bent backwards exerts heavy strain on it. So we usually try to place the area or the item being attended to at eye level. So the head and neck may be excessively extended when the chair is tilted backward, especially in the barber shop. So you can request for the barber to provide with a hairdresser or a pillow that would make you feel less comfortable. So when lying down, use a bed. We recommend only one pillow, because usually when you have two pillows, it would also cause neck pain due to prolonged contraction of the muscle of being maintained at the flexed position. And then it is also important not to really do a lying on your stomach, because this puts excessive strain on the neck and shoulder muscles and may injure your nerves. So when sitting, we already talked about this earlier. So I'm just going to skip this part. And then here I have the different basic postures that you can do as a morning routine to exercise yourself to prevent neck pain and shoulder pain. So you can just take the screenshot of the slides, and also I can send these pamphlets to you after this lecture. Okay, so usually we have this what we call the morning mobility routine, where it is important to mobilize our neck as well as our shoulders to get ourselves ready for the day, in order for us to prevent any occurrence of neck and shoulder pain. Okay, so that ends my talk regarding work injuries and cumulative trauma disorders. Thank you.
Thank you so much, Dr. Rajiv. That was very informative. And I'm not sure. I want to ask the audience if which ones of those pains you are having right now. I think I'm having the neck pain. Anyone would like to ask or share their experience or their thoughts? Okay, so I guess that was very well explained, as there are no questions, no hands raised as of the moment.
Thank you. Thank you also for having me to participate in this Zipinar.
Okay, I think that concludes this session for today. Well, I really appreciate speakers for your efforts and your knowledge. With along with it is the experience that you have shared with us today, and also for the audience through YouTube and Facebook. For their contact and details, you can always reach to Let Us Talk It team, and also you can reach Nika through LinkedIn. And for Dr. Rajiv, you can contact me or the Let Us Talk It team again for other questions or any other matters you would like to get connected with. Well, this concludes the session for this Wednesday, and we hope to see you again next Wednesday again, the same time. So that's 12 p.m. to 1 p.m. US Eastern Standard Time. And for India, that's 9:30 to 10:30 in the evening. And I forgot what time it is now in Estonia, but definitely we really appreciate the effort for Nika and Liz for inviting her, joining this session for today. Again, thank you so much, everyone, and hope to see you again. All the best.
Thank you. Bye.
Thank you, Rajiv, for a great session. Very methodical and informative session. It's needed for the computer experts sitting in a very sedentary lifestyle. Thank you again.